Good evening. Thank you for joining us for our third, or maybe I started talking too soon. I'm going to start again just in case my first
Okay, yeah, sorry, I'm just trying to get us light. Isn't it weird?
Oh, okay, so we're live. And thanks everyone for joining us. We're here with Courtney Howard and Maureen McCue. I'm Lee Haynes from the People's Health Movement. And if you haven't joined us before, the People's Health Movement is a network of activists and institutions and organizations who all are struggling for the right to health and think that health should be a right for everyone. Before we get started, I want to say that if you have any questions for the presenters, there are a few ways you can ask questions. You can post them in the Google event page. You can post them in the Facebook event page. Or there is a Q&A app inside the Google Hangout. If you move your arrow on the screen, a menu comes up on the left and it says Q&A, and you can post your question there. And I'll do my best to check all of those sources and questions. So we'll get started with Courtney and Maureen. Welcome, both of you. Thank you for being with us tonight. Also, Baj couldn't make it. He is working in rural Canada and doesn't have internet access. So, welcome everyone. And Maureen, could you introduce yourself and maybe talk a little bit about your background and what you do and what you've been doing?
Nice to meet you, Court.
Nice to meet you too.
Oh, I think Maureen's frozen. Okay, well, while Maureen's getting unfrozen, Courtney, would you mind telling us a little bit about yourself?
Sure. So I am an emergency physician in northern Canada. I live in Yellowknive, which is in a subarctic region, but north of 60. I work at our territorial hospital here. My husband is a pediatrician who's in the high Arctic right now, so our kids are currently being occupied by a screen right now, and they may come to say hello. So yeah, I do a lot of work on climate change and health. I got interested in this actually after working on a pediatric malnutrition project in Djibouti, which is in the north of, just north of Somalia, with Doctors Without Borders. You know, it's difficult when you spend 6 months taking care of kids who are severely malnourished. There's a relatively high mortality rate. And moving from there to northern Canada, where we're already over 2 degrees Celsius warmer than we were at baseline and are having, you know, health effects, makes it an issue you can't really ignore. So I've spent a fair bit of time over the last couple of years working on this, doing presentations, starting to do research, and doing quite a lot of advocacy locally and at the national level with the Canadian Association of Physicians for the Environment, where I'm a board member.
Okay, thank you.
So I'm going to switch my screen over to the presentation now. Yeah?
Yeah.
Okay. So
while you're doing that, I'll just say that the People's Health Movement in USA and Canada wanted to organize this series of webinars just to highlight the work that activists have been doing in communities, especially in the US and Canada, to combat climate change, and to also talk about strategies to grow the movement and how we can further mobilize. So Courtney's going to talk for a bit about the work she's been doing in Canada.
Hi, yeah, can you see my screen?
Yes.
Perfect. So this is actually a presentation I gave a couple of days ago to the Northwest Territories Public Health Association, and it's based on ones that I've given to the National Public Health Association up here in Canada, as well as the National Emergency Medicine Association. It's a bit northern focused, but I'll try to go relatively quickly through just to give people an idea of the biggest target points, the biggest health effects and the biggest target points. So again, I am a board member with the Canadian Association of Physicians for the Environment, and that's really the group that I work the most with, as well as with the local groups here in Yellowknife. I don't have any conflicts of interest except that giving birth to 2 little kids in the last couple of years has really extended the number of years that I care about out quite a lot. I don't make any money from this, except I've accepted speaking money from my professional associations because I can't figure out how that's a conflict of interest. So why is a medical doctor standing up there talking about climate change? So this is actually a picture of my grandmother's flooded field in Manitoba. She lived there for 99 years and only ever saw these fields flooded twice in the last 5 years of her life. So, you know, these are food producing fields, and this is yeah.
Switching.
Pardon?
Your slide didn't actually change.
Oh, really?
Yeah.
Oh, okay. Huh. What are you looking at right now?
The cover slide.
What are you looking at?
Your cover slide.
Oh, that's all, eh? Huh.
Yeah.
What do I do here?
But it's okay if you just want to not use slides and talk.
What are you seeing now? Still?
Yes.
Still the cover slide, eh? That's too bad. I wonder if I have to screen share. What if I advance this? Oh, technology.
Really? I mean,
Yes.
mine kicked me out right in the middle of a sentence, and then all of a sudden it reappeared. God only knows what's going on in the pixels somewhere and electrons out there.
Let's see here. So screen share. What if so now you see me, right?
Mm-hmm. Looking
And,
good.
thank you. Let's see.
So while you're, do you want to go ahead or
Let's see.
Okay, because
Don't know why this one is not working.
That out, Maureen. Would you tell us a little bit about your work and what you do?
I started to say greetings from the land of floods, and then Courtney was going to talk about her grandmother's flood. We've had 3 500-year floods since 1993, and we had 1 major drought in between the floods. So by training, I am a primary care physician and a medical anthropologist. That's my PhD. And I am the coordinator of Iowa PSR chapter for almost 20 years. I've been on the board off and on of the national. And much of my time is spent either teaching or doing PSR work, and it's been focused on colon health, climate change and health, and then also disproportionate impacts of both vulnerable communities. And I've been teaching at the university for a long time, and with PSR, talking with EP staffers and elected officials. My classes are all experiential, so at times I get my students to work on some of these things, and I'm doing a lot of collaborative work with many of the local environmental groups. That's my background for the time being.
Okay. Well,
How are you doing, Courtney?
Well, I just don't know if it's going to. Are you still seeing the cover slide there?
Yep.
Yeah.
I don't know what's going on.
If it's okay, if so Courtney wanted to use slides just in case her kids ran through.
Well, and also it's kind of useful. Well, okay. Well, how about I'll just go through the presentation, and you will look at me.
Yeah.
Is that better, maybe?
Yeah.
Okay. All right. Well, hello. Okay. So just looking at what I talked about with the Public Health Association. So as we know, the Lancet in 2009 basically made headlines by calling climate change the biggest health threat of the 21st century. And then happily followed up with that last June, saying that tackling climate change is the greatest opportunity for global health of our time, which I think has sort of opened a wave of energy internationally. that is really catalyzing change right now. And I think one of the major things that they said in June that was helpful was that we need to get out of our silos and really work in a multidisciplinary way if we want to get things done. And so I think health is really coming into more of a central role in the discussion because of some studies and just personal experiences that have shown that if you frame climate change in terms of health, it's just much more motivating for populations in terms of taking action. So when I go through this with people, I talk about just some of the basic values. You know, in medicine, we need to know vital signs before we can really understand how where someone's at. And so I would say that the vital values of climate change are, number one, that we're trying to keep global surface temperature warming below 2 degrees of Celsius increase. Currently, our trajectory is somewhere around 4 degrees by 2100. When you add up the promises currently submitted to Paris, it now looks like we may be able to keep it to 2.7 degrees Celsius if everybody follows through on those, which is good.
So these numbers that you're saying, some people listening might not know what you're talking about. So you're talking about basically the Earth is getting hotter because of climate change. So what have you seen, or what do people say as far as you've heard and what you think are some of the things that might happen, with the Earth heating up, and like health consequences?
So, where I live, there's no climate deniers up here. Even our right-wing politicians are not climate change deniers because it's so obvious that things are changing. We are already over 2 degrees Celsius warmer than we used to be.
Wow.
Straight up. So, it doesn't exist. That conversation doesn't actually exist up here. So, yeah, up here we're already over 2 degrees Celsius warmer than we were at baseline. And the worry is that the rest of the world will get over 2 degrees Celsius warmer than we were at baseline. And that has huge consequences for basically a lot of the systems that we depend on for health. And I think it's very important to just know what the bottom lines are in terms of what we need to do in terms of decreasing emissions. When they've looked at how much carbon we can still afford to put into the atmosphere and still remain below 2 degrees of warming, it looks like we actually need to leave at least 80% of economic fossil fuel reserves in the ground, according to the Intergovernmental Panel on Climate Change. So that means that we have to be really careful about our carbon budget, and that's really useful information, especially for a resource-producing nation like Canada, to have in mind as we, make our plans going forward. So, if we need to leave 80% of our fossil fuel reserves in the ground, we need to be careful which ones we extract and what our plan is for a transition.
Yeah. So you are with CAPE, the Canadian Association of Physicians for the Environment. What types of strategies or initiatives have you all used to try to get that word out and maybe educate people a little bit more about?
So it's important to know a little bit about what's happening, right? Mm-hmm. So up here in the north, the major things that we're seeing are unstable ice. So people still do a lot of hunting for land-based foods up here. We have a large Aboriginal population, and that makes up a large proportion of their healthy, lean protein. So when it's tougher for them to get to the game animals, their nutritional status goes down, and it's also just more dangerous. So the possibility of trauma, falling through the ice, goes up. It also means that they're more isolated socially because people do use ice roads up here to get around, and if you can't, or for less of the season, you can't. It's more difficult for you to travel to see your friends and your family in the next town. If it's more difficult for you to take the highway down to the bigger center to do your Christmas shopping or your shopping, it just means that you're more isolated. There's less possibilities for social contact. There's less possibilities for you to do things like buy groceries and buy supplies to help maintain your house. We've also seen a lot, unfortunately, of wildfires. We're in a drought situation up here and have been for a couple of years. In 2014, we had essentially terrible air quality for 2.5 months in Yellowknife. I'm currently doing a study to look into the health effects of that. But what we saw anecdotally was the emerge was full, seemed to be full, we haven't run the numbers, of people with asthma exacerbations. And certainly our air quality was bad enough that you would expect to see that based on what's already been shown in the literature. So lots of asthma, lots of itchy, watery eyes, lots of coughing, people using more puffers than they usually use, and people just being really crabby because we had to stay inside for 2.5 months of summer after a really cold winter.
And before, I'm sorry, before we went on air, we were talking, or you mentioned that mental health effects of climate change aren't talked about very much. And some of the things you're saying, like being isolated and not being able to go anywhere, seems like it would have an impact on people's mental health. So what are some mental health impacts you've seen?
So there's actually, that's part of the study that we're doing into the health effects of the wildfires. So we actually are doing interviews with people that will be analyzed by a qualitative researcher to get a sense of what impact it did have on their mental health. There's actually been some very well done research up in the Eastern Arctic by Ashley Consuelo-Willox and her group looking at the mental health effects of climate change itself on the Inuit. And there's this really interesting word called solastalgia. And solastalgia is actually homesickness when you're still at home. So it's essentially missing the way home used to be. And when you get elders and you talk to them, we had a Aboriginal health conference down here, and we flew people in from the high Arctic and all around the territory and got them all in a sharing circle and got people to share what they were seeing. Youth from Inuvik were saying that, the fish weren't where they had been even when they were younger, and that they were sad that they weren't able to share those fishing experiences with their parents. Elders from further north in the islands in the higher Arctic are actually seeing a lot of what they call landslides, which are essentially permafrost slumps, where permafrost at the bottom of the hill is exposed and starts to melt, and essentially the whole hillside gives way. So these slumps are changing the entire landscape of the Arctic, and mean that lakes are basically disappearing as the ground under them gives way. Some lakes are emptying into the ocean. It's really changing the landscape. Risk of contamination of water as the turbidity increases and drinking water is affected. Things are getting just warmer, which means that bugs that didn't usually cause trouble are causing more trouble. There's even more mosquitoes forecast to arrive in our area than there used to be. Increased risk of waterborne and foodborne disease, E. coli, Campylobacter, Giardia. And food insecurity is really, really the crux of, I think, our problem locally as well as on a worldwide level. And in terms of mental health effects, I've been presenting on this topic now for a couple of years across Canada, and it really puzzled me, and I don't know how you feel about this, Maureen, but it really puzzled me initially, wondering, with the Lancet having said that climate change is the biggest public health threat of the 21st century, why is my profession not kind of getting going on this? Because doctors are usually...
Yes.
What's that?
I said this is our big question too. We just had a major global health, climate health summit, and we had people from the AMA, we had people from APHA, etc., and everybody's talking about how can we get the whole healthcare profession engaged, but it's like pulling teeth. But APHA here in 2017, the theme will be climate and health, but really, that's just still 2 years off.
Yeah, well, I don't know how you feel, but increasingly, I'm sharing, when I present, I'm actually sharing a slide of somebody in the fetal position. Because I've come to the conclusion, I think, that mental health is as much a barrier for our profession to get involved as it is for our society in general to grapple with this problem. You know, I think that doctors who are very good at relaying difficult diagnoses to patients are not so super awesome at dealing with difficult diagnoses that affect themselves and their family. And I think that all of the same, you know, avoidance, magical thinking, all of these same defensive maneuvers that we see when we relay, you know, diagnosis of cancer to people are being manifest in ourselves. And I think our level of insight into that from a, like, you know, psychiatric mental status exam perspective is really low. And so I'm starting to really address that very directly when I present to people. I'm asking them to take a moment as I'm presenting to just think about or write down how climate change makes them feel, and then to take another moment to think about, is that feeling affecting your ability to manage this problem on both a personal and a professional level, like to discharge your professional responsibilities. Then asking them if there's things that they can do to try to get themselves in a more productive state of mind.
I think part of the problem is also that the mental health or the mental, you know, makeup of physicians is they have to be on top of all the data. And they're not going to embarrass themselves talking about something on which they don't have a sense of deep intellectual connection. And I think because there has been so much, you know, bizarre kind of so-called debates about the science, you know, that it leaves them scratching their head. And meanwhile, you know, they're already working their 80 hours a week, and so they don't sit down to figure out where is the truth or where is the real data, or, you know, that sort of thing. And I think that's a piece of it as well. I mean, they don't deal with racism, and it couldn't be more in your face on a daily basis, but they don't believe that they have anything to do with adverse outcomes of diverse populations. So this is, I mean, it's part of the whole makeup, and coming up with the approach that gets them engaged and gets them to take that leap to be able to talk about something where data isn't 100%, you know, clear or free of controversy is, I think, part of the problem.
Yeah, well, I think, you know, and I agree, and, you know, we're working at CAPE with the Canadian Association of Physicians of the Environment on materials to try to lower the barriers for people, you know, like, so the presentation is there and done, so the handouts are there and done, yeah. You know, all super well referenced, because, I mean, the references are there. And I think that, you know, is going to help. I've had a lot, you know what, oddly, was really helpful up here? Was forcing people to make a decision on divestment at the Canadian Medical Association. You know, I brought forward all of these very difficult to argue with, I have a child arriving, motions in the past, but it turns out that when things, oh baby, sorry, I'm gonna have to go here for a second. Oh,
everyone say hi.
Go for it, Maureen.
Thanks, Courtney.
Gone.
Maybe she'll come back. So y'all's conversation was really interesting, and one question, we're kind of a little bit all over the place, but I think that's okay. One question that I did want to ask, in the first webinar we did, Brian Paris of Tejas down in Houston talked about doing work in communities and people they work with having all these health impacts, but not really being able to connect with medical professionals and get medical professionals to come into the communities and talk to people. And I wanted to ask both of you what you might think that disconnect or may be between physicians and the communities, and any ideas you might have to bridge that gap. Because I know in Iowa it seems that at least you with PSR is really involved with the community. So I don't know what y'all may have done that's been successful that might not be being done in other places.
Well, I think some of the answer is similar to the one to Courtney. It's where doctors work, what their impressions are of what counts. And our work in Muscatine, which is an area that's very polluted, and it also floods. So they have it coming directly from the CO2 producing, the toxic air pollutant producing industry in that area, and then they get the floods, and they're living in, you know, low income, poorly developed housing, et cetera, et cetera. So they, at least before the Affordable Care Act, you know, many of them didn't really have access to health care. There aren't physicians in these poor areas, and they don't go into them. You know, we tried to work with the public health department. In fact, I was on the board of health in my county, and we tried to work with the Department of Health, Board of Health in that county, and really weren't interested. It took a long time. It took really organizing the locals to speak up and speak for themselves, get lots of letters to the editor, radio interviews, things like that. And eventually, you know, they started to pay attention. But it was like pulling teeth to get EPA in, to get the DNR in, and to get any, you know, health professional backup, because people don't go into these areas and they don't see it as their responsibility. You know, they go to clinic at the hospital and they see who comes to them, and they don't see who doesn't come to them, who can't come to them. It's finances, it's all the isms, you know, between sexism, racism, classism, etc. And then the people in the area itself, for a long time, you know, would grumble to themselves, but they'd be afraid to speak up because they were afraid of losing their jobs. And, you know, it is an employer. And so if you speak out against the polluters are going to take out revenge on you by, you know, firing you. And so everybody's a little nervous. But gradually, a lot of conversations, a lot of presenting the data, sort of like what Courtney did, you know, and interaction with the community began to get things moving. And I think for us, the real turning point was engaging an interesting group called Global. I wrote it down. Let me look. I got my notes. I didn't. It's called Global Community Monitor, and we taught the local people how to do their own air monitoring, air quality monitoring. And it was we had to have a grant for it. It doesn't come free. We brought in the program director to help teach people. So we just put out the call in the community, you want to learn how to do this. And so they had to come for a few hours of training to learn how to capture both gases and particulates, and then send them off. They had to be done very carefully, but they sent them off. They get the results, they can then publish the results in the local papers and things like that. Then all of a sudden, EPA started to hear. And EPA already knew they were not in compliance. It was just that nobody was pushing them to do anything. So it was a matter of educating people to actually take some control and then continually pushing on the agencies that are there to protect them. And long story short was in the end, and I don't know if you noticed in one of our little movies, we had a couple of them, they did win a lawsuit for damages to property, not damages to their health, but damages to property. And when you see the awfulness of the buildings and the sort of destruction, basically, of the paint on homes and on cars, and you think about that same caustic element in their lungs, to me that was all quite amazing. But just like the coal industry can't or often won't admit that somebody has coal miners' pneumoconiosis because they can say, well, they're smoking or they live in a smoking household or something like that. And so even though most of our residents didn't smoke, that's always one of those things. You have a very hard time proving a respiratory disease is linked to the air quality. So anyway, it's been a saga.
I wonder if, Maureen, if you would, because Courtney talked a bit about the community, I guess, in Yellowknife and across other parts.
A map of Yellowknife at some point. It would be really nice to know where you are. Are you in the Peri-Arctic area?
Oh, you're muted, Courtney. Oh.
Do you know Courtney? Have you met her?
There we go. Can you hear me?
Yeah.
Yeah. Okay, sorry. I put the. I have a child here again. Oh, little one. Me and my little one live. Yeah, we're in a subarctic area. We're north of 60. We're on the shores of Great Slave Lake. Yeah. So just in terms, I think I'm gonna have to go here. So I'll just tell you a few things that CAPE's been working on. So we were very involved in the coal power phase out in Ontario from a couple of years ago. So that's already improved air quality, and they've actually seen some decrease in air pollution related admissions to hospital in Toronto, which has been really positive. We're also involved in a major campaign in Alberta to try to get them to phase out their coal power plants. They're responsible for 6% of Canada's greenhouse gas emissions, and so that would be a pretty big deal. It's a coalition with the Asthma Association, the Lung Association, and other health-related groups, and we're actually having a lot of traction. The elected government committed to it as part of one of their campaign promises, and actually so did two of their opposition parties. So I think that that's going to happen, and it's just a matter of time and a matter of advocating for cleaner energy to replace the coal, as opposed to, just switching to gas-powered electricity generation. We were involved in having the Canadian Medical Association divest from fossil fuels, and we were talking about trying to get Canadian physicians involved, and it was interesting. Of all of the motions I brought forward, and as a small medical community here, it's actually a very good opportunity to be able to go to the National Medical Association, because there aren't a lot of people trying to go. We just don't have that many doctors up here, so if you want to go, you can. And so I've been 3 years now and written motions for 4 years, and the divestment motion, what I'm realizing is that the doctors learn when they're under pressure. Like if you give them, yeah, like everybody, right? But it was all of a sudden, they had to actually read the motion and read through all of the rationale for it, because they knew that if we pass it, if we pass it or if we didn't pass it, we were going to make headlines. And so it was really a catalyst, and the reading that physicians did in preparation for that motion has made it a lot easier for me to recruit people from other parts of the country to help. I have a network of speakers now that's much bigger than what I had before, and I think it's because we were all forced to make a choice. In terms of like the history of social movements, inevitably there's a conflict stage, and I think that within the medical community in Canada, that was a bit of an opportunity to bring that forward. And moving forward, the Canadian Medical Association is making climate change and health one of the focuses for this year's General Counsel. Dr. James Orbinski, who accepted the Nobel Peace Prize on behalf of Doctors Without Borders, will be speaking on that because it's one of his current research topics of interest. And basically we're trying to develop a network of physicians across Canada who can speak to climate change and health, and basically be the climate health doctor for their communities. So to do things just exactly what Maureen has been talking with, to support them with evidence-based information if they're involved in fights around coal power or around fracking, to emphasize the need for climate-friendly agriculture, to emphasize the need to protect fresh water to get us through whatever bumps we've already signed up for in terms of the changing climate, to advocate for active transport, because there's great evidence that biking and walking to where you want to go has better health outcomes now. And so that, really CAPE's had good success, and I'm sure you've had good success when we are trying to encourage people to make changes that have immediate health benefits and immediate savings to the healthcare system now. that also decrease greenhouse gas emissions. So biking to where you want to go, riding to where walking to where you want to go, putting bike lanes in, making sure that there's showers at hospitals, making sure that hospitals are on, bus lines are all things that doctors can easily get behind because they're already in their offices trying to convince their patients to exercise. And there's such good evidence for that now. The clean energy generation. I think that those are the real low-hanging fruit, and that's where CAPE's been spending most of its energy, and looking at the Global Climate and Health Alliance that's forming, and what was in the Lancet publication in June. It seems like that's really where the health community worldwide is really targeting a lot of its energy. And I worked with a economist up here in the NWT on carbon pricing, and what worked well was I would go first and speak about the health effects of climate change, and then he would, and then by the time my audience really, really wanted to, quote, do something, quote unquote, I would be like, and here is Doug to talk to you about what the World Bank, the IMF, everybody says is probably our strongest, sharpest tool to getting a handle on decreasing emissions. And I don't know if you noticed, but the Lancet's commission in 2015 had a really, really awesome paragraph endorsing carbon pricing. And so it's just getting easier and easier for physicians to get involved in that discussion. And so on the basis of those experiences, we actually passed also a motion in the Canadian Medical Association this year, getting them to promote the beneficial health effects of carbon pricing, because again, as carbon emissions go down, air pollution will go down, and we'll expect to see some immediate positive health effects from a respiratory standpoint, as well as decreased costs. And the IMF and others have modeled that, and that makes it easy for us to refer to that. So those are the main things that I've been working on, as well as just trying to support my colleagues who've been working on it, because I do think that the mental health effects of all of this, are substantial for advocates. And I'm a peer support worker for returning expats with Doctors Without Borders, and I try to be a peer support worker for other climate health advocates, because I think that that support network is really important to kind of keep people going. But I feel lucky to have entered the conversation when I have, because I really feel like there's this major upswing with the World Health Organization getting super involved this year in preparation for COP21. It's not a difficult sell anymore, whereas even 5 years ago it was a difficult sell within the medical community connected climate change and health.
Courtney, sorry to cut you off, but you just mentioned COP21, and we only have a few minutes left, and I did want us to talk about that a bit, because it's happening soon, and it's sort of a big deal. So for anyone who's watching who doesn't know, world leaders are meeting in Paris at the end of November to negotiate an agreement, like a binding agreement on steps that countries can take to reduce greenhouse gas emissions and other things to combat climate change. And so, Maureen, I wonder, has PSR been, or have you, I guess, been, I know you've been following COP21, but what have you all been doing kind of leading up to it?
Well, we all know that our president's program that he will be presenting at the COP, the Congress of the Parties, or whatever it's called, it's basically his clean power plan, but a little bit strengthened for the Canadians or anybody else on the call. The clean power plan is essentially a call to eliminate the gases essentially from coal-fired power plants, such that we are 30% lower than 2005 levels by 2020. It's not the strongest program, but it is the first and only one to come out of the U.S., out of the EPA, which is in charge of keeping our air and water healthy. And it does directly address coal-fired power plants. And so there's a lot of pushback right now, which everybody knew would happen because we have a very contentious legislature, Congress. But that is what he's going to bring to the table. A lot of people say it's nowhere near strong enough, but it's as strong as he can get in the state of the U.S. right now. Unlike Canada, there is a lot of controversy that remains. And now, you know, they're saying they don't want an agency like the Environmental Protection Agency making plans like this and telling people what kind of fuels they can have or not have. And so that's where a lot of the fight is right now. And a lot of people feel that they will not prevail, but still, you know, it's something, it's more than nothing as in past years. And at city levels, at state levels, regional levels, there's a lot more going on than what's in the Clean Power Plan. And there is also a large movement here to put a price on carbon. PSR, there are some representatives from PSR who will be at some of the civil society organizations in Paris. And for those of you who don't know about Ed Fallon, who walked across the country with a whole bunch of people talking about climate change, he walked across the country. He's walked across to Iowa, and now he's
the Great Climate March.
Yeah. And then he's going to walk to Paris from landing on Normandy, because he's talking about how a mobilization on the order of the mobilization for World War II is what is required. And so he's getting out and saying that in as many ways and places as he can. So he's one of our Iowa folks who are going to be there. And so I think across the country, people who are working on cleaning up the air from coal, from fracking, from, you know, any of the petroleum products, support the Clean Power Plan, but they support a strengthened approach, and they support also carbon pricing. And so we'll see how it goes after December.
I that one of the negotiating points of the treaty that they're going to be working on is to actually have health mentioned in whatever comes out of there. Do you know what's going on with that right now, or
I only know we send a lot of letters to all of our elected leaders to the White House, and we have sent several, and a lot of people have worked together to get the strongest possible language in there about health. And we've done testimonies, you know, for the environmental advisors to the White House and so on, and at every point always bringing in health. I mean, the health spectrum related to climate is mind-boggling when you think of changes in, you know, microbial life and insect life, when you think of the changes in food and water quality, as well as air quality and injuries, and mental health not being the least of the long list. I mean, there just are so many health implications. And so people have been taking up that banner and using that cudgel, but you know, it remains to be seen how well they're heard. I was going to ask Courtney about the tar sands when she's talking about cutting out coal. What is the process with the tar sands? But maybe she's not there at all anymore.
Yeah, she's gone. We actually have only a few seconds left.
Oh, okay, sorry.
Yeah, so I don't know if you have any final words, or because one of the goals of this webinar series is to help people figure out maybe how to get involved in climate action in their communities, especially people who might live in rural areas where there might not be a lot of action, or they might feel isolated from what's going on. So, so if you have any final words, encouragement, or
well, I think that the points of engagement are so many and so diffuse that we are seeing farmers changing some of their practices because of the changes they're seeing in their crops and in their water quality and things like that. And so rural communities have been getting together, food-related concerns, local food, and farmers markets, you know, they're involved. I just think there are so many ways to get involved. It's hard to almost make a list because there are so many entry points. And while we didn't discuss it too much, I really do think like the Black Lives Matter here in this country is also taking up climate change, and particularly from the point of view that so many frontline communities happen to be communities of you know, African Americans, Hispanic Americans, and so on. And there have been some interesting reports recently about how
oh, Maureen.
okay, I'm muted. So weird. Anyway, someday the digital devices will fulfill their promise. But anyway, I mean, we just talk in as many places as possible. I spent the day 2 days ago with a bunch of junior high students. We had 150 junior high students talking about security. We have to change the conversation. We have to put our money where our mouth is. I think that's one of the important things that we do need to talk about is how much money do we spend on the military? How much money do we spend on climate? What are those connections? I think until our budgets reflect our values, you know, we're going to continue to struggle. So there's, you know, any number of points of, you know, involvement.
Right. Okay. Well, thank you so much for your time. I'm sorry that there were technical difficulties and things, but I think that that it was a good talk. So thank you so much.
No, I enjoyed meeting you. I enjoyed meeting Courtney. I don't even know if there was a fourth person involved, but at least the three of us had a nice talk. And I hope to learn more about both what you guys are going to be doing in PHM on all of this and what Courtney's doing. I'd love to learn more. I've been also working with some Native Americans in Minnesota off and on, and you know, so it's kind of just would be interesting to bring all these contacts together.
Yeah, and I think that hopefully, you know, that'll be happening soon. One thing that PHM is doing, at least PHM US and Canada together, is organizing a People's Health Assembly. Maybe you've heard about it or seen emails at least.
Yeah, no, I've gone to several of them. I went to the one in Bangladesh. I went to the one in Ecuador. So yeah.
We're having a regional one for PHM US and Canada next year in August after the World Social Forum. And so hopefully we'll bring a lot of right to health activists and climate justice and environmental justice and people working in trade and health together because we're all, you know, working for the same goal. And it's, and, you know, we think it's important, you know, that we kind of work together, have the same language, and, you know, just have an idea of what each other is doing to kind of grow a stronger movement. So,
you know where it's going to be, the assembly?
Montreal.
Oh, well, that's a nice place to go to.
Yeah, so I'm gonna stop the broadcast right now and thank everyone for joining, and we'll see you next time.
Okay, thank you. Bye.
Bye.